So the uterus, we know it literally dances every day. The position will be different. With the bladder position also, it can be completely anteverted, retroverted, and also sometimes in a fixed position. So if you draw the uterus like this in a planning scan, you see that part of the the tumor is missing here. And if you draw the tumor like this, we see that a lot of bladder is into the into the target volume. And we see here it's an anteverted uterus, and the uterus is falling down, but the target is going on the back. So instead of treating the uterus, you are treating the rectum there. So all these problems are tackled now with the kind of adaptive therapy what we do with MR-Linac. So I'll be rushing through the slides because I know we have a lot of important topics which are coming up. So this is the routine kind of treatment, which is IGRT based machines where everywhere people treat. And if you see the numbers, earlier we used to treat these patients with IGRT around 1600 to 1650 cc of volume used to be treated, but now our volume has come almost all half of it, almost all 800 cc we are treating now. So this kind of total reduction in the integral dose has reduced the side effects to the patient to, it's a dramatic kind of responses. If we see the patients, like the tumor control has been always good even with the IGRT machines also, but the kind of side effects these patients used to have when they were treated with IGRT is something which we don't see now with these latest technologies. And this is the protocol for cervical cancer patients. We have reduced our external RT doses from 50 gray to 45 gray, and the reduced dose is now compensated with more of brachytherapy, because brachytherapy is a highly specialized treatment, and where you introduce the needles or the tandem and other applicators directly into the tumor, and I'll show you how that has improved the treatment outcomes. So this is one example of a cervical cancer patient. Here we can see on the first week of radiation, we started with 240 cc of volume, and by the end of the radiation, we have treated only 150 cc. So if you have to compare this, it will be almost all 50% reduction in the volume, which you cannot achieve with any kind of IGRT machines or even with proton therapies also, because we do not have the adaptive therapies yet with the proton therapy. And this is one very peculiar case of retroverted uterus. It was a fixed uterus, and it doesn't move a single millimeter also every day during radiation. And we can see how this uterus has been targeted with only a few millimeters margin without treating the normal structures. So as I told you initially, these are all very bulky tumors, and we see a lot of responses during the radiation. At the end of radiation, sometimes we see almost all complete reduction. So what we do for the patients who do not respond with external RT, that is after 45 gray, that is 25 fractions of external RT, we usually do a MRI scan to see what is the response of these tumors with radiation. And then at the end of external RT, we reassess with the MRI, and based on the amount of disease we have, we take up those patients for a brachytherapy, which I'll show you little later. So this is how we have reduced our volumes during radiation. This is one 85 years old lady who had a very locally advanced vaginal cancer, and she had almost all tumor which was invading the rectum. So this patient has been treated with MR-Linac, and fortunately this patient is doing very well even now. So this is how we could reduce the toxicities to a minimum possible level. And even in post-op cases also, this is one post-op case of endometrium. Normally what happens once we remove the uterus from the pelvis, the entire pelvis, vacuum will be filled with the small bowel. So whenever we have to treat with adjuvant radiation in those post-op cases of either endometrium or post-op cervical cancers, we end up treating lot of small bowel there. But if we can reduce, see, this is the amount of bowel and rectum which we treat when we treat these patients with the normal IGRT machines. But this is how we could reduce the volume with MR-Linac. So just to give you the small numbers, from 1200 cc, we have reduced it to almost all 900 cc, which is, I mean, in fact, we have almost all reduced the bladder, rectum and bowel doses by almost all 10 gray, which is a huge difference for a radiation oncologist.